So funny. What's wrong, Billy?
My doctor says I have Skittles pox.
Are they contagious?
I don't think so.
The varicella zoster virus is a virus that enters the body through the respiratory tract. This virus is an enveloped double-stranded DNA virus that can also be contracted by direct contact, by touching a blister or saliva. And this is an example of someone that might have contracted the virus, like a little kid, through the nose or the mouth, and those little red pox are pretty much what it looks like. Chickenpox disease is an illness that can last 5 to 7 days. Its symptoms include headaches, fever, tiredness, loss of appetite, and a funny looking skin.
Complications from chickenpox can include dehydration, pneumonia, and secondary skin infection, most often group A strep in high-risk populations.
This is showing the replication of a DNA varicella zoster virus. Starts with the attachment. The virion attaches to the host cell. The entry and uncoding. The virion enters the cell and its DNA is uncoded. A portion of viral DNA is transcribed, producing mRNA that encodes early viral proteins. And then we go to biosynthesis. The viral DNA is replicated and some viral proteins are made. Late translation, the capsid proteins are synthesized. And then we go to maturation, where the virions mature, and release, where the virions are released.
Treatment for chickenpox in otherwise healthy children is mostly symptomatic. Antihistamines such as calamine lotion or use of oatmeal baths can help relieve some of the itching. Keeping fingernails trimmed can help prevent skin infections caused by scratching blisters. When treating fever related to chickenpox, over-the-counter medications such as Tylenol or ibuprofen can be used, but always avoid aspirin medication for the risk of Ray's syndrome. Always remember, never use aspirin for treatment of viral symptoms, as Ray's syndrome is a disease that can affect the liver and brain and cause death in children. Treatment of chickenpox differs in adults and those who are immunocompromised. Antiviral medications, specifically acyclovir, is prescribed to reduce the severity of infection and is available in oral and topical forms of treatment.
Vaccination. The common name for this vaccination or drug name is Varivax. The first dosage is usually given to patients between ages 12 to 15 months, and the second dosage is given to patients 4 to 6 years old in order to prevent the chickenpox.
The chickenpox vaccine saves lives and prevents serious illness. The U.S. vaccination program began in 1996. Before the vaccination program began, chickenpox caused more than 100 deaths every year. It also caused more than 10,000 hospitalizations every year. More than 4 million people got the chickenpox every year. Since the vaccination program began in 1996, there has been a 90% decrease in deaths, meaning fewer than 20 people die from chickenpox every year. 84% fewer hospitalizations, meaning fewer than 1,700 people are hospitalized for chickenpox every year. 92% fewer cases means that fewer than 350,000 people got chickenpox every year.
Complications from chickenpox can occur, but are not common in healthy people who get the disease. High-risk populations include those who are immunocompromised, which can be HIV/AIDS patients, chemotherapy patients, and those on long-term steroid use. Pregnant women and infants are also at very high risk of complications after contracting the varicella virus.
Shingles is caused by the same virus that causes chickenpox, the Varicella zoster virus. When you have had chickenpox, the virus stays in your body, and even though you may not have symptoms for years, it may reappear in your body. Shingles is more common in people over age 50. You cannot spread shingles unless you have a rash, and if you have a rash, you could transmit the disease to someone who has never had chickenpox. Shingles is very painful. It includes burning and shooting pain, tingling, and or itching. It usually starts on one side of the body or face. If not caught early, these symptoms could last for a long time, even years. A shingles vaccine is recommended for ages 60 and over, or for those who have diseases affecting their immune system.